A warm welcome to you all, and thanks for joining us at our latest ARCFEST. You see on the welcome slide, I've put the link to the pre-meeting reading, and somebody will put that in the chat bar at the side in case anybody didn't get a chance to look at that yet. You can look at that during the break if you want to have a quick catch up, and there'll be various other things to see today. I'm glad to see so many of you are here with us today. I think this is the highest number of people we've ever had registered for an ARCFEST. So I'm looking forward to catching up with familiar faces and meeting some new ones. Just some basic housekeeping rules, which I'm sure you're used to now. Please keep your microphones on mute unless you're speaking. The meeting's being recorded. However, if you're unhappy with that and you're uncomfortable, please do feel free to turn your cameras off. But when you're in meetings, if you can, it's nice to see faces. We encourage you to use the chat function or the question and answer section, and our staff will also respond to any queries via this channel. It's very important that you click on the name of the sessions on the left-hand side, or you will be left behind as the agenda progresses. Just click on the next session title after each one finishes, and you will move automatically on. You also need to click on the theme meeting you chose to attend when you registered, when we get to that time in the meeting. And as I say, that link I've got on that slide there, which should now be in the chat, has got some prep reading that we sent out before the theme meetings, if you want to refer to that either in advance or during the meetings themselves. The technical support details will be put in the chat, and any issues, please do get in touch with us throughout the day. This is our 5th virtual ARCFEST. And the one in December this year, the dates have already been sent out for your diary, is also going to be virtual. But we're really hoping that by March, when we have our next meeting in 2022, we will be able to be going hybrid with face-to-face and virtual meetings. We've changed the format of this ARCFEST today because of feedback we had from members, advisors and staff. It's shorter. We're using new techniques to present our work streams and update to you all. Remember, the ARCFEST is a forum to collaborate. So please ensure if you see something in the theme and you see a member of staff named and interested in a project, please do engage with them. After this introduction piece, you're going to be invited to watch a selection of videos we put together, which offers a snapshot of what our 4 research teams are doing and what they're planning to do. We currently have over 150 live projects across our themes and 62 members as part of this collaboration. That's organizations as well as all our public advisors. I still would like to remind you that yourselves, members, advisors and staff are the ARC collaboration. It's not something passive, it's an active membership. That's why it's so important that you engage with each other, get involved in our projects, share your ideas, and then you can help us disseminate our work across your organizations and to people that you're in contact with. Because you'll all have a stake in it and you'll be interested in what we're doing and what it means to the people that you work with and know. Our theme portfolios are diverse and are at the cutting edge of some of the key issues our members and the populations that we serve face. This spans work from improving air quality to increasing physical activity, opportunities for the population who need them most, looking at ways to reduce unplanned healthcare, exploring the use of remote and digital online services for healthcare. We're also developing grants for research into process prescribing, and we have, of course, our ever expanding dementia research portfolio, which is now expanding into care homes, and numerous data-related initiatives that we're working on, looking at how we can use large data sets to underpin and undertake research. There are far too many to mention here, but I hope that today offers you that much needed bird's eye view of the organisation and the research that we're doing, all of which is detailed on our website, including who to contact to get involved in any of these projects. I'm also pleased to inform you that we've been continuing to secure some significant grant income and are part of a number of very large national and international projects. As an example, there's the recent £7 million study our Care and Health Informatics team are part of, which will be exploring how transforming cities with nature can reduce health inequalities, particularly for those with non-infectious chronic conditions such as heart disease, diabetes, cancer, and mental health problems. All of this work is only possible through our very robust public involvement, which we'll also have a brief update on today. Just a reminder, that we have now had our funding confirmed until the end of September 2024. So that means that in the longer term, it's even more important that members complete their prioritization survey that we send out after this meeting, so that we can get your views on how we shape our work going forwards, and how you can influence what we're doing, and also how you can volunteer to participate in the different studies that we're setting up. Each of our member organizations has a lead, and these leads are contacted monthly by their allocated ARC core team member. These member leads, remember, manage the co-funding resources for their organization. So they need to be aware of what their staff are doing in their organization alongside the ARC. If you're not sure who your lead is, if you're from a member organization, please go to your R&D team in your organization, or a senior colleague, or contact us and we will point you in the right direction. So there are some specific points I briefly want to mention to members at the end, but first I want to do a brief presentation about our research development networks, which provide further opportunities to engage with us. So, as I've said, we need you to engage with us. It's really important that we get your views, that you vote on the projects to help us prioritize our workload for the collaboration. This happens during our theme meetings and also in the survey that we send out afterwards to member leads. Please indicate which of our projects you want to be part of, and please help us disseminate our findings to your colleagues. We're looking still for some professional co-leads for our themes. This is for staff working in non-university member organizations who want to help lead our themes alongside our academic leads and our public advisor leads. Please contact your organization lead if you're interested in taking on one of these roles. We reckon it will take no more than 4 hours a month to undertake it. And if you want to find out more about that, please go onto our website and you'll find information there. And also, some of our member organizations, we still need to finalize signing off the member agreement. So if you're one of the leads and you haven't done that yet, please do contact your lead or us at the core team, and we'll discuss that with you. So remember, our ARC needs you, so please do engage with us. It's our ARC. So let me talk about these research development networks. These bring together academics, trusts, local authorities, voluntary sector, primary care, third sector organizations, and the public to drive and prioritize our co-produced proactive programs from our research themes. So we respond to ideas and queries from members, but we also have this mechanism where we've highlighted key areas that we want to undertake research in, and this is a way of bringing together a network to work on this together. And the RDN's membership isn't just for ARC members and public advisors who are interested with ARC, it's wider than that. So we're also looking for other people with an interest in these topics from our region. So what are they for? Well, they help us share who's doing what within these areas of mutual interest and priority, who is involved in social prescribing, who's got novel ideas, who are the innovators. It helps us broaden these networks to make sure the right people are sitting around the tables looking at this potential research ideas. It allows us to take advantage of a variety of skill sets across our members and those that we're in contact with, so that we can write the best possible grant applications to bring in inward investment to underpin this research. The groups will help us finalize the research questions and prioritize the proposals to work on. We can also share information about where we think we might be able to get funding for research, what the calls that are coming up are. And at the end of all of this process, we co-create high quality grant applications, and each research design network is intended to pull together and submit at least one highly competitive, relevant, co-produced application within the first 6 to 12 months. So these are the ones we've got at the moment: social prescribing, social and community mental health and well-being, seaside towns and communities, and digital healthcare, and more are planned. Why be involved? Well, it helps you prioritize the research and be part of a larger collaboration applying for competitive grant funding for our research program. There are no criteria to get involved in these RDNs. It's having an interest and having a desire to be involved. And we, as I say, we have a large variety of people, both from inside the ARC and external to the ARC, participating at the moment. Please email us if you'd like to get more involved. So I'll stop sharing at that point and just finish my talk. So a couple of final points I want to make just about our progress. So last time we looked, I think it was last week, and I think it's gone up since then. Well, I know it has because there's a couple more I'm aware of. We had 122 publications already since the ARC started, coming from our ARC work and staff, which is not far behind the 155 we got in the whole 5 years of Clark. So we're really motoring in ARC in terms of our outputs and papers. We put these papers on our website, so please do have a look and have a search and see what you can find there, and help us disseminate those findings. And we also have, as you know, a number of PhDs. John Moores is currently putting some adverts out for some more PhDs this Christmas. So we will be approaching over 30 PhDs hosted by the ARC by the end of that latest recruitment. So that's all from me. And you're now going to hear about our public advisors. No, you're not. That's the next thing. Sorry. You're now going to see a series of short films summarizing the work that we've been doing in our themes. Apologies. I'm getting ahead of myself in the running order. I'm too excited.